Well, welcome everyone. This is Joseph from Adjuvant Protocols for Healing. Today is the monthly webinar on Thursday, December the 15th. And I wish you all a very merry holiday if I don't get to that at the end of our time. As you know, this is the second in a series on the vascular health. I was thinking, just sitting here for a few minutes, as to why Western society has so much trouble with cardiovascular, diabetes, all the neuropathies from the eyes to the toes. And it all has to do with what we're considering here is vascular health and much more. And the other thing that I thought of was, if I could have devoted the Nutritional Insights into Vascular Health Part 1 to a product, it would be Cyruta Plus. It would definitely be the varied bioflavonoids and other vitamin P and other factors in that product to vascular health. By the way, that product was made in 1950, before I was even born. It's been around all these years, and yet all this trouble that people have had. And today, looking at part 2, microvascular and macrovascular complexities, particularly hemorrhoids and varicosities, toward the end of the hour and a half that I'm going to touch on, I would devote today to Collinsonia root. Now, some of you maybe you haven't used that product that much. After today, you will be using that product, not only for yourself, but for your family and others. A much unknown and product, and one that is not used that often. In the last session, we looked at, the anatomy of blood vessels and the different kinds of blood vessels that we're all aware of: the arteries, the veins, the venules, the capillaries. But the one that we haven't discussed, at least I haven't discussed, is the lymph vessels. Remember that all of the material that doesn't serve in the blood, how does the body get rid of it? It sends it into the lymphatic system. So if an individual's lymphatic vessels are not healthy, if they're not functioning well, then a lot of that material gets passed back into the bloodstream. It doesn't go back to the liver to be disposed of. And so that's very important. The other thing we looked at last time had to do with the actual makeup. And that's why I said last time I would have devoted that to the product Cyruta Plus or Cataplex C or Cyruta, any of the vitamin C complexes by standard process. Never assuming on anyone's part that ascorbic acid is going to have an effect on blood vessel health. It will not. In fact, it is damaging. And I'm not going to get into that controversy over that, but I can tell you that there's a number of studies out there, especially kidney damage. So anyway, that was for last time. And the fact of the significant role that vitamin C plays in connective tissue, in the smooth muscle cells of the veins and arteries, capillaries, and lymph vessels, and endothelium, the skin cells, that thin layer of the lumina of the of the blood vessels themselves. And of course, the basal lumina too, which is what the dermal part of the vascular structure sits on, is another, just so you're aware of that. So why is it Dr. Lee made these products? And collinsonia root, by the way, was made in 1955, or he didn't make it, he brought it on the standard process line. So why? Well, here are the major factors we're going to look at today. And there's 4 of them. And it relates to, these 4 relates to glycation, which we'll get into in a second, all of these. Too much carbohydrate, too much glucose in our diet. The blood-brain barrier and its relationship between the central nervous system and the blood vessels throughout the body. Baroreceptors, which that manages and helps with messaging throughout the vasculature of the body. Now, baroreceptors, until I decided to teach this, I knew nothing about it. So, and the last factor has to do with the liver. So we're going to look at these in the next hour or so. So let's get into glycation. And the reason I put this in was I was telling my son-in-law, who's a medical doctor, and I was giving a lecture on vascular health. And he said, well, don't forget to include glycation. And I hadn't thought of it. You know, when I teach diabetes or other things, I always consider that, definitely, and diabetic neuropathies and other outcomes of too much sugar. But I never thought of this. So what is glycation? It's sometimes called non-enzymatic glucosylation, is the covalent attachment of a sugar to a protein or lipid. So that's important because we have talked about, and most of us really get into more of a high protein diet. But a high protein diet with any added carbohydrate or sugar creates these glycation factors that really break down the vasculature of the body. Typical sugars that participate in glycation or glucose, fructose. Now, you know, you've listened to me for years. You know that I'm not a big proponent of a lot of fruit. I'm not, for this very reason, because it has to do with this glycation factor and their derivatives. Glycation is the non-enzymatic process responsible for many micro and macrovascular complications. Yes, we know diabetes mellitus, and is implicated in some diseases and in aging. Too much fruit and aging. Too much carbohydrate, aging. Glycation end products are believed to play a causative role in the vascular complications, they're saying, of diabetes, but much, much more, from your eyes to your toes. So, and here's a couple of articles I gave you if you want to read them through. I found them related to this glycation end products, as they call it. Vascular effects of advanced glycation end products, content of immunohistochemically detected AGAs in radical artery samples as a predictor of arterial calcification and cardiovascular risk in asymptomatic patients with chronic kidney disease. So you can, I only picked two of the many that relates to this. When there's too much sugar, it affects all of the vasculature in the body. Now, why are they studying this with kidneys? Well, the kidneys are what? They are blood vessels, pretty much. It's a very vascular ridden organ. Advanced glycation end products are proteins that become glycated after exposure to sugars, prevalent diabetes, vasculature, and contribute to development of atherosclerosis, hardening of the arteries. So, you know, and I know, we have so many clients now. How many clients call you? Well, I got to get on statins. I've got to get on medicine. I need a pacemaker. All of these factors are related to poor arterial tone. And we'll go deeper into this today. But this is one big factor. Now, obviously, you can listen to my lecture on type 1, type 2 diabetes. But if you wanted to, you could say, well, Joe, okay, well, I've got these clients that have these issues. What should I use? Well, you would go here in my book, Adjuvant Protocols for Healing, and you could just use the top product. You don't have to get into related to vascular health, all of these products, though they all are contributing to the health of the vascular system in a roundabout way and a specific way. But the pancreatrophin PMG, in my experience, is the #1 product for helping people with too much out of control sugar in their whole system. And you can get into these other products and you can listen to my lecture, of course. And the same with type 2, which is the most common, is now I have GTF, which is the regulator, but I still say the #1 product. So if you had a client that tends to, you know that they're really heading for vascular health, you can see the veins in their chest. They have varicose veins. They suffer from hemorrhoids. They bruise easily. Their gums bleed, all of that, whether it's the microvascular or the macrovascular. They have all of these coronary things beginning to show up, arrhythmias. You have to consider sugar. Now, I could just give you off the top of my head now 3 clients that their A1C, they're struggling with that, and they have arrhythmia problems with their heart. And they have hemorrhoids. So is there correlation here? I would say yes. I would say yes. Because remember, these blood vessels feed all the goodness, all the blessing, all of the oxygen and nutritive bounty from the bloodstream has to get there to the tissues. And it gets there through the capillaries, the blood vessels, the venules, and the waste taken away. So you could say, well, Joe, how would you list this conversation today? How would you list it? It would be in my top 5. It may be in my top 3 if I thought about it. Because unless an individual keeps their vascular system, their vascular alliance healthy, nothing else is going to work. Even as I would make #1, you know, the endocrine conversation, an endocrine balance, but hormones cannot get there through a poor, tired vascular system. So this gets right up at the top of priority of health. So you could say, well, Joe, you know, this client's only going to take 3 products. They have very bad vascular health. And they have, you know, they have this high A1C, type 2 diabetes. So what I would give them is Cyruta Plus, Collinsonia root, and pancreatrophin. That's what I would give them. Now, some people like Diaplex, and that's good, but there's not, this is a good maintenance, unless you do very high dosages. But I like to go with the straight protomorphogen, full strength. So yes, you can bring herbs in for sure. So that is the piece for glycation and this high amount of glucose that we are bombarded with every day based on individual choices. We eat, as Westerner Americans and Western society, we eat way too much sugar. So the next area has to do with this blood-brain barrier. And in many ways, I've discussed this many times over the years. The blood-brain barrier is a term used to describe the unique properties of the microvasculature of the central nervous system. This is, by the way, the blood-brain barrier is what protects the brain from many toxins and impositions, which they explain here as I read through it. The central nervous system vessels are continuous, non-fenestrated vessels, but also contain a series of additional properties that allow them to tightly regulate the movement of molecules, ions, and cells between the blood and the central nervous system. So we're always thinking of, well, just the brain here, but the central nervous system is throughout the body. It's all the way, the nerves that are all the way down the whole spine. This heavily restricting barrier capacity allows the blood-brain barrier to tightly regulate central nervous system homeostasis, the balance. Are you sympathetic? Are you parasympathetic? Or is the individual balanced? Which is crucial to allow for proper neuro function as well as protect the central nervous system from toxins, pathogens. Remember, these are blood vessels. These are blood vessels that have this regulatory, these regulatory factors that keep pathogens out of affecting the central nervous system. Inflammation, injury, and disease. The restrictive nature of the blood-brain barrier provides an obstacle for drug delivery. This is a real problem for conditions like Parkinson's. These drugs, the body is keeping these chemicals out, rightly so. Of course, they're trying to get them in, but through the central nervous system, and thus major effects have been made to generate methods to modulate or bypass the blood-brain barrier for delivery of therapeutics. I would not recommend that. Loss of some or most of these barrier properties during neurological diseases, including stroke, multiple sclerosis, brain traumas, neurodegenerative disorders, is a major component of the pathology and progression of these diseases. Okay, well, they're saying it. And the last is the blood-brain barrier dysfunction can lead to ion dysregulation. So these ions, I'll touch that so you understand that. These ion communicate, that's the next thing that I'll cover, related to the electrical, how the body electrically the tissues of the body electrically respond. Altered signaling homeostasis, balance, as well as entry of immune cells and molecules into the central nervous system. Here is where you get autoimmune conditions like multiple sclerosis, where the immune system now is attacking the brain, the spinal cord, the spinal column. So, the spinal cord. So this all ties in with how healthy this blood-brain barrier, the blood vessels in there are. Now, you could say, well, Joe, that, you know, that's all good. I'm glad to know that. But how can I offer products that that help? Well, the main products that I would use in this, when you know that there is these situation, there has been head trauma, there has been MS, there have been other neurological degenerative disorders, there's been infection in the brain. I would use pituitrophin, because remember, we're really looking at this as how we could keep the integrity of the brain and the blood vessels related to the brain and prevent the immune system from attacking not just the brain, but the brain of the brain, which is pineal, hypothalamus, and pituitary. So pituitrophin is always my go-to, because this is really the modulator of the central nervous system and how it works with this vasculature and these blood vessels in the blood-brain barrier. Of course, and I added, I was just going to give you the pituitrophin. Of course, we want to think of neurotrophin as well for the brain overall. But really the product, if you say, Joe, it's getting to be too many products. Okay, you could use one, and here it is. Because this has brain, pineal, hypothalamus, and pituitary all in it. It's a great formula. It was made after Dr. Lee died. John Courtney and some others put this together along with Imuplex. It's a great formula. But if you wanted to, if you feel like this is a factor, these are people that have a lot of eye problems, a lot of ear problems, migraines. This is a great product to introduce. So now we have these products, but really the regulators of the central nervous system are going to be mineral combinations that really look at if a person is too fast, it slows them down. If they're too slow, it brings them up. So here are the minerals that work with the pituitary, work with the hypothalamus in regulating the central nervous system through the vascular system. Now, I'm not going to go into this in detail, but potassium is really the one that regulates vagus nerve function. It is the one that helps with glucose, regulating glucose in the muscle. And so, very important. Now, remember, potassium, it's a little footnote here. Potassium is necessary for acetylcholine. So that is what wakes you up in the morning, the secretion of that neurotransmitter, and it's what helps you go to sleep at night. So here it is. This is all tied in to not only the central nervous system, but the vascular system as well. So those are the 2 slides on organically bound minerals. And you can read about the other things. I'm not going to go into that. I would say this about organically bound minerals. It's not just potassium. It has iodine in it. It has magnesium in it. It has every mineral that is on this planet for the human body through sea lettuce. That's the only source on Earth that carries, in essence, all the minerals for the human body. The other, if one is too slow, and of course, all of you that have followed me with the heart sound recorder, we see a lot of people that their hearts are too slow. You need this mineral for this central nervous system balance and autonomic nervous system balance, which is part of that, which is phosphorus. Now, you remember that this is the accelerator or control for the autonomic nervous system and the glands. So especially people that are aging and their vasculature is not functioning well, you may have to bring in a product like this. So the next area I wanted to talk about are these bioreceptors. So this is fascinating. Bioreceptors are a type of mechanical receptors allowing for relaying information derived from blood pressure within the autonomic nervous system. Now, you and I have clients that we say, I can't regulate, I can't get there without medication, we can't regulate their blood pressure. Information is then passed in a rapid sequence to alter the total peripheral resistance and cardiac output, maintaining blood pressure within a present normalized range. There are two types of bioreceptors: high pressure arterial receptors and low pressure volume receptors. And these all relate. These relate to the vascular system in this sense, which are both stimulated by stretching of the vessel walls. Now, this is an amazing mechanism. Arterial bioreceptors are located within the carotid sinuses and the aortic arch. So they are a part of that vasculature that determines whether the arteries and the blood vessels surrounding the heart in this instance can stretch, can stay flexible, it doesn't become like a straw, but stays like a flexible hose. This is how blood pressure is regulated, whether it's too low or whether it's too high. Low pressure volume receptors or cardiopulmonary receptors are located within the aorta, atria, ventricles, and pulmonary vasculature. This is why I brought this in, because I didn't know about this. I didn't know that there were these receptors. Now, and remember that these bioreceptors that monitor the blood pressure and help us maintain a constant blood pressure. What regulates them? Well, here's a couple of things that I found. Bioreceptors are mechanical receptors located in the blood vessels near the heart. They're part of these blood vessels that provide the brain with information pertaining to the blood volume and pressure by detecting the level or stretch of the vascular walls. As blood volume increases, vessels are stretched and the firing rate of bioreceptors increases. Now, you could say, well, what controls them? So that's where I go when I'm looking at this, and what supplements relate to this. Well, here is where we get into the relationship of blood vessels with the B vitamins, More than 100 types of ion channels, that's what these mechanical receptors are, have been described thus far. The new ones are still being added to the list. They are responsible for the electrical excitability of muscle cells. So what's a big part of the vascular system, these smooth muscle cells. So they tie in with this, relating to blood pressure, blood volume, and the life and integrity of the blood vessels themselves. And they mediate most forms of electrical signaling in the nervous system. So are these bioreceptors important? It's amazing, isn't it? So, what I wanted to read here, which I've already shared with you, and remember that this may explain why many older people have orthostatic hypotension. Now, listen, some of you have come to me. I cannot get this. I'm working with a client right now. They cannot get his blood pressure up. And his pulse is 34. But you know what? Since I've been giving him, now that all relates to these bioreceptors and the relationship of B vitamin to these bioreceptors. This electrical, how do they say it? The electrical excitability of the blood vessels, specifically the smooth muscles in the blood vessels. So now his pulse is in the low 50s. It's not normal. It's not 34. He's now not passing out, hitting his head on the counter and other places. So this is why many older people have orthostatic hypotension. Now, again, you think, well, most people have high blood pressure, but there is a few, and they're tough cases. They're hard to work with. A condition in which the blood pressure falls when a person goes from lying to sitting to standing. People get up, they get dizzy. That all ties in with this. This causes dizziness because there is less blood flow to the brain. The capillary walls thicken slightly. This may cause a slightly slower rate of exchange of nutrients and wastes. The main artery of the heart, the aorta, becomes thicker, stiffer, and less flexible. This is probably related to the changes in the connective tissue of the blood vessel wall. There's your vitamin C. There's your Cyruta Plus. This makes the blood pressure higher and makes the heart work harder, which may lead to thickening of the heart muscle, hypertrophy, and other arteries also thicken and stiffen. So here's the antithesis of what we were talking about. It's either low or it's high. We want the balance. In general, most older people have moderate increase in blood pressure. It's a natural. So let's see if I can play this video. I'm praying. I've got to share sound with you. All right, let's see if this works about these bioreceptors. I guess it doesn't work. All right, well, I tried. But you have it, and you can go on here and listen. So everything I've been saying, not related to the B vitamins, but these bioreceptors. This is a fascinating conversation. So what are the supplements really that we need to look at to enhance this baroreceptivity in the blood vessels? Well, Cataplex G, now, I know some of you have been calling us about this. They've changed it now to Cataplex B2 because whatever, politics, reductionism, who cares? And I am saddened that they took it away. They don't call it Cataplex G because Cataplex G, Dr. Lee called Cataplex G after Dr. Goldberg. Dr. Goldberg saved part of this country, the ones in the early 1900s that had pellagra, that they thought they were putting these children, they were isolating these children because they thought it was a disease that could spread. Now, pellagra, as you know, is a B3 deficiency. By the way, pellagra is also a tryptophan deficiency. You may not have known that. So it is a protein deficiency and a B vitamin deficiency, specifically niacin, B3. So he was the one that, instead of these children being isolated and people being put into mental institutions, began to feed them foods, i.e. red meat and other foods that are high in niacin and tryptophan. Remember that B3, the tryptophan, makes melatonin. It is the amino acid. Remember, hormones are made from fats and amino acids. So the amino acid that helps make melatonin and serotonin is tryptophan, which is part of this B3 factor. Too little niacin, B3, too little tryptophan, and you get pellagra, which is dermatitis, diarrhea, and dementia. Now, or other mental aberrations. Now, so you can see that it's now called cataplex B2. But what saddened me was Dr. Lee called it cataplex G to honor this Dr. Goldberg. And you can get into the archives of Saline River Press and read his story. It's a great historical knowledge that we all need to have as to why certain standard process products were called what they were, to honor specific people that saved many lives, true healers. And so this Dr. Goldberg is still high in my heart. And every time I take this, I actually think of him. And I take both of these. I take G and cataplex B core. So remember that this is the side of the B complex. So here is from your product bulletin on cataplex G: night sweats, paresthesia, a burning sensation in the soles of the feet. Now remember what I just explained. I know it was complex, but remember the burning in the soles of the feet have to do with poor vascular function, which G helps with because of these baroreceptors. Crawling sensation, redness in the palm of the hands, muscular control, loss of muscular control, numbness, angina, venous congestion. Here it is, visible veins on chest and abdomen, hemorrhoids. Now, you might think, Joe, G for hemorrhoids? Yes, G for hemorrhoids. Eye symptoms, blurry vision, feeling of sand in the eyes, which is very common here in Colorado because it's so dry. Loss of appetite, melancholia, apprehensive, all of these mental aberrations, and nervous system related to the digestive system, where you get that individual with a digestive system just cannot relax. That's a pellagra, signs and symptoms. And so this product is very important. And in my opinion, I take both B core and G every day. I never miss a day without it. I've already taken mine this morning. So you can get into this, the attributes of cataplex G. By the way, G is the one that you use for warts on the skin. Dermatitis, skin issues, you got to get G. You got to get that B2, that B3. And standard process calling this cataplex B2 is not entirely accurate because there is much B3 in here as B2. It should have been called B23. Anyway, don't get me in trouble. I'm just kidding. It doesn't matter. It's a great product. It hasn't changed. The ingredients have not changed. So But remember this, if you see visible veins on your clients, you know that they have a vascular issue. Now you see it in young people, you say, oh, no worries. But that is a sign of what is coming down the road. Observe the body. Veins in the chest, veins in other parts of the abdomen, veins in the legs in young people. That's a sign. That is a deficiency syndrome showing itself to you. So, and so, as you know, standard process split G, cataplex G or B2 now, and cataplex B, and they're listed here, but remember that standard process makes, they may emphasize B2 and B3 in cataplex G, or B1 and B4 in cataplex B, or B core, but all the B's are there because they're substances from nature. All the B vitamins must occur together in nature. And so this is from one of Dr. Lee's writings, and you can see that which the cataplex B core or B complex, which B vitamins are emphasized in that product and what they help the body with, and then the cataplex G as we're talking about. So the other one that is in the G is choline, both choline and inositol, because they're more lipotropic B vitamins. They tend to stay in the fat parts of our body longer. The B1 side tends to be more water soluble, and so they are washed through the system in 72 hours. So that's why you need to take these B vitamins every day. And so the research shows, I just looked this up on choline as an interesting. Some research shows that getting enough choline, remember, choline is a physiological detergent. It's a fat emulsifier. And this ties in with what we're going to talk about in a second with the atherosclerosis, which relates to hemorrhoids. It relates to varicose veins. It relates to all of these conditions. The fat and the calcium plaquing up the arteries, veins, and capillaries. Choline might help. They never give these supplements credit, these natural substances, but that's all right. Might help keep the heart and blood vessels healthy, partly by reducing blood pressure. So remember, and what is cataplex G used for? People with hypertension, high blood pressure. What is cataplex B core or cataplex B complex used for? People with normal to low. Now, will B core raise blood pressure? No. These are self-regulating. Only if it's high will G bring it down. Only if it's low will B core bring it up. So you don't have to be concerned about that. At least I haven't found that in my 50 years. So other research suggests that higher amounts of choline might increase cardiovascular disease. So you can read about that too. But that's only using, you see, in reductionism, they're just using choline. If you use it in conjunction with all the other food ranges of the B vitamins, that's never an issue. So just be aware of that. So if you were going to use choline, by the way, the standard process choline is a synthetic. It's not from natural sources, but take it with cataplex B core or cataplex G or one of the other, cataplex B12, because they all have the full range of the B vitamins. You won't have any trouble with that. Most people with fatty livers and most people with atherosclerosis and most people with circulatory problems need choline, extra choline for sure. So now here is a a vein clinic, which you can open up and read about. And because really, I'm glad to see this, even though they're using synthetic, but I'm still happy to see this. This family of vitamins is among the most important to strengthen your blood vessels and thus prevent vein issues, or at least keep them at bay if they're already surfaced. For those who have a history of vein issues and blood clots in their family, vitamins B6 and B12 are particularly important. B6 and B12 work together to get rid of excess homocysteine, which is the amino acid that build up too much and can lead to blood clotting. So B3, niacin, in the spotlight when it comes to circulation. It also plays a role reducing cholesterol in your blood. So here it is, even medically. And here is Dr. Lee's thoughts on choline, which you can see. The number one for choline is gallbladder symptoms, intolerance to fats, chronic indigestion, jaundice, constipation. Yes, he's using choline. This isn't a misprint. Choline tablets. Liver disease, fatty degeneration, venous congestion, diminished urination, hemorrhoids again, constipation. So you can read through this, but you can see why choline is such an important B vitamin for not only these baroreceptors, but for many other, which is I just have listed. Now, there are 3 products that have good amounts of choline. We already talked about formerly Cataplex G, now known as B2. Soybean lecithin has phosphatidylcholine, and lecithin, remember, makes up about 30% of your brain, and I forgot, quite even more of your liver cells. So, or is in those cells, is lecithin. So that's very important. And we use this a lot with the high, which I'm going to get to in a second, the high second sounds in the aortic, in the heart sound recorder. And choline straight on. Now, you could say, well, Joe, when do I use this? Well, if you know a person has a fatty liver, you should be using one of these 3 products forever. But you should start out using the straight choline, because it will help manage that fatty liver. I don't know if it could ever reduce it or get rid of the fat in the liver, but that's a real problem. Look up side effects or outcome of fatty liver. It's horrible. So now I'm not going to go into this too much, but remember that I wanted to honor both sides of the B complex that Standard Process provides for you. And Dr. Lee used masterfully. And so this is the B1, B4 side. And remember, the Cataplex B core has defatted wheat germ. It has rice bran polishings. It has liver. It has beet and nutritional yeast. So all of these have the full range of the B complex. Now let's get into this whole circulatory and this vascular breakdown that happens in aging. Peripheral artery disease, also called peripheral vascular disease, that's more accurate, because the congestion, the plaquing is not just in the arteries. If it's in the arteries, everyone, it is everywhere. It's everywhere. A circulatory condition in which narrowed blood vessels reduce blood flow to the limbs. Peripheral vascular disease, a sign of fatty deposits. We just talked about that with the choline, the G especially, and calcium buildup in the walls of the arteries, arteriosclerosis. Risk factors include aging, diabetes, smoking. Symptoms may include leg pain, particularly when walking. And here's the thing. Here's the great irony. If people haven't had these substances or been exposed to them, been taking them their whole lives, they get to their retirement age. They get to their older years. Now they can go out and walk every day, but they can't because of this narrowing in their legs, this plaquing. You know so many people that have this as they age. The rate of blood flows through the human body changes response, as statement described these factors. A high viscosity of blood causes an increased resistance in the blood vessels and leads to slow blood flow. Viscosity refers to the thickness of the blood. This thickness is caused by the number of red blood cells. Thick blood travels through blood vessels at a slower rate than thin blood. It's very logical. Blood pressure, the factors that most directly affect blood flow are blood pressure, blood volume, and resistance and activity level. So this is more on this. Oh, what I want to read in this one, you can read it through. When the heart is relaxed, blood pressure is lowest. Now, this is the way you tell is the diastolic pressure, the lower number. What do we say? 120 over 80. If it's 120 over 85, that's to be watched. If it gets above 85, then you know when the heart is relaxed, the blood pressure is not low. It's putting too much strain on the blood vessel wall. This is called diastolic pressure. Some pressure is maintained in all the vessels all the time. Even when the heart is in dystole rest, this pressure is kept relative constant by the elastic properties of the walls of the arteries. Well, Joe, how do I keep my elasticity? Cyruta plus, Collinsonia root are the main two. So there it is. Very simple. And keeping the levels of sugar and fat and calcium out of the bloodstream. Those substances belong in the tissues, not in the blood. The blood is going to pack it away somewhere, and where it packs it away is on the arteries and capillaries. As people age, plaque builds up in the arteries, increasing blood vessel resistance, which leads to disease. So how can you tell? So this is a client, friend of mine, and takes standard process, good. And if you're on today and you don't use the heart sound recorder, it's okay. And even if you don't have one, you're welcome to be on my lectures, which is usually the second and fourth Tuesday of every month, early in the morning, 8 o'clock Mountain Time. So how do we tell through this graph? So there's a few things we can tell. How do we tell when there is balanced viscosity of the blood? Whether that thickness, whether there's less pressure in the rest cycle on that artery. It's right here. So the way to read these is all 2-to-1 ratios. Look at this. This is the systolic, diastolic. This is dystole. This is rest. See it? The blood is refilling. This is the blood. This is the time where the blood is moving from the lower part of the heart to the upper, and that should be rest too. The heart should not be working. So this is 2-to-1, but look at the height for today. All you need to know is the height of the second sound should be half the height of the first. Good, good, not good, good. Now you'll see that some people like this is good, this is not good. This is adrenal stress, kidney. that's another conversation. But what I want to focus in on today is right here. This means that this gentleman, his blood viscosity is too thick. Now, that thickening can come usually from too much calcium in the blood. Well, what carries the calcium? How do I get rid of the calcium out of my blood? Vitamin F is the nutritive transport mechanism. The nutritive transport mechanism of calcium from the blood into the tissues. Very simple. You want less? Take more vitamin F, fish oil, any of your vitamin F substances, linseed oil, or yeah. Anyway, all of these different oils have that vitamin F factor. So the tuna omega-3 is probably the best vitamin F product in oils, and the F tablets in the dried form is the best source of vitamin F in standard process. So sesame oil, they all carry that vitamin F factor. So, and then there's the fat. Most likely, we know that this atherosclerosis, this hardening and narrowing and plaquing in the arteries is atherosclerosis, is the hardening, but athero, the plaquing, is from too much fat caused by too much carbohydrate, too much fruit, too much grains. No grains, no starches, no fruit. That's the gospel according to Joseph, or as little as possible. So here it is. Now, so there is that one. And then this happens to be mine, and I'm not bragging about myself or comparing, but I just wanted to show you, because we couldn't find get a good one of the normal aortic that I set up. Oh, this is my mitral valve. Oh, Lynn, we put the wrong one in. But anyway, the second sound should be this height to this height. Second sound to the first. Okay. So we'll change this out, and I'll put one of mine in that is more, or another one that's more balanced so you can see. So what would we do for this to help with this microvasculature that is beginning to plug up? Well, there's food, of course, which we just talked about, exercise, and products. So here's your Cyruta Plus again. Remember, or this is Cyruta, which they are almost identical in nature. But when there is plaquing, Cyruta is really the one that this individual should take. Because it has components in the seeds that are in this product that dissipate the buildup of that plaquing that is going on. So right there. And then, of course, your soybean lecithin or choline, we talked about that, fat emulsifiers, and, of course, the beta food, which after that fat is in the bloodstream, it has to get to the liver and get out of the body. Here is the supplement that helps with the thinning of the bile, which removes the fat from the liver out through the bowel. So those are your, you could say that this is the triad of cholesterol, as Mark Anderson calls it. Okay. Now again, there's other things. A person with this showing here, garlic is great for them. The garlic forte from Mediherb, garlic in your food, and there's your tuna omega-3 as well. Now, the other thing that I like for this circulatory factors. This could be called the brain blend or the circulatory blend, is these three herbs in liquid form. So what you could do is blend this up, and you take 1 tablespoon a day. So a tablespoon is 3 teaspoons. And so in the blend, if you take a tablespoon and a teaspoon is 5 mils, you take these. And remember that what we talked about was the movement of the red blood cells. Where is that? Yes. Anyway, wherever it is here. The ginkgo in this formula is what helps. This is WD-40. This helps lubricate and reduce the friction on the red blood cell to move through the arterial structures and the veins and the capillaries of the body. The red blood cells move more easily through the vasculature because of ginkgo. So think of it that way. Gotu-kola is similar to Cyruta Plus as far as integrity of the collagen, and Bacopa is also known for that. Remember we talked about that blood-brain barrier? This is the herb that is able to break that blood-brain barrier and get up and benefit circulation in the brain. It's for cognitive function. Well, how does it do that? Well, it helps increase circulation in the vasculature. So this is a great, and we should put brain blend, but circulatory blend on there as well. Now, how would you know if you're not running HSRs like here? How would you know? How would you know if someone is having challenges? They need to do this once a year. You go. It's a Doppler technique that they use, and they test your carotid artery. As the carotids go, so do the coronaries. Arterial test, disease, abdominal and aortic aneurysm test. The gentleman who is a writer for soccer just died of an abdominal aneurysm. They couldn't figure out why he just dropped dead. On autopsy, they found it. These tests check for this, and atrial fibrillation test. So, and it also does peripheral, arterial, peripheral. It checks your feet as well. So that is the all related to the circulatory and the the circulation with the arteries and atherosclerosis. What is the other thing when we start to look at conditions like hemorrhoids and varicose veins? Well, we know that when we look at this, we all always think of Collinsonia root. Anybody that's grown up in the standard process family, we know that that's all tied in with the Collinsonia root is the key product for hemorrhoids and varicose veins. But why? Why does that herb do that? And you know, when I trained with John Courtney back in the 70s, from 72 to 76, I trained with John, was my teacher, and I would call him, and he would say, remember, Joe, everyone knows Antronex, this product, is tied in with allergies. It's a natural antihistamine. But it also is a key product with hemorrhoids and varicose veins. And of course, Joseph said, why? And he said, because it dilates the portal vein. So here it is. portal hypertension and high blood pressure of the portal vein. The portal vein is a major vein in the abdomen, collects nutrient-rich blood from the intestine and delivers it to the liver to nourish it, where it is purified for the body to use. Great. Like other organs, the liver needs oxygen and nutrients to function, which it receives from the portal vein. After the oxygen-rich and nutrient-rich blood passes through the liver, it flows into the hepatic veins and into the inferior vena cava, which takes it back to the heart. Here's the money line. Blocked or reduced blood flow at any point of this process, after I just had Mexican food, Chinese food, pizza, blocked or reduced flow at any point of this process will result in increased pressure inside the portal vein. When this occurs, blood is detoured into other smaller veins that ultimately allow blood to flow back to the heart. However, these little veins can't do it. However, and that's where you see the veins, the spider veins, the veins on the chest and the abdomen. This is what's going on here. However, these smaller veins can enlarge and form varicosities, varicose and dilated veins. There it is. The most common cause of portal hypertension is cirrhosis, which refers to hardening of the liver because of scar tissue. By the way, that ties in with a fatty liver, which ties back in with choline. Just as a side note here, I don't want to get too going back, but what I said prior to this point in this lecture all has come to this point, which relates to these conditions, mainly varicose veins and hemorrhoids. The other primary cause of portal hypertension is due to clots which narrow or block flow through the veins to and from the liver. Portal hypertension is fairly uncommon, but when it occurs, it most often occurs in older adults and may result in death if untreated. But people aren't dying of this, but it is a factor. If you have poor vascular, or your clients or your family or if they have poor vascular function, and you're going to see, I'm going to read to you that 3 out of 4 people in their lifetime have hemorrhoids. 3 out of 4. So you could probably say almost 100%. What's that? 75, 30, it's not, yeah, 75%, right? So the dilation of the portal vein is so important. And that is why John taught me Antranex is a key product. Look at, and also when a person has, as you read back through this, if you want to go back and read your notes, if they have hypertension all over, high blood pressure, and medications, supplements aren't doing it, portal hypertension is the primary cause. Here it is. The first clinical consideration that Dr. Lee said about this product was not allergies. Allergies is the third one. It's hypertension, headaches, insomnia-related symptoms, hyperthyroidism. And so then he goes allergies, hyperirritable tension, headaches, insomnia, drug issues, because alcohol and drugs is going to create this congestion in the liver and related to the portal vein. So, and here he says, Antranex may be generally described as the liver detoxifying hormone. In other words, it is the substance in Antranex is a messenger to the portal vein in particular, and the liver to dilate, to open up, to not close up. So, and here he says here, liver disease. Here it is, venous congestion, redness in palms of hands. Again, we looked at that with choline, but here is another nutrient that all of these signs and symptoms, redness in the face, redness in the hands, redness in the feet, are all signs of liver congestion. And so I took this out of my book as far as this peripheral, these peripheral issues, vasculature, poor vascular function, is you've got to get out and walk. Everybody needs to be walking 30 to 60 minutes a day. Far infrared saunas, and then things that move the chi, that move the blood flow from the head to the toes, yoga, tai chi, and particularly hatha yogurt. So in conclusion with this section, we talked about Cyruta Plus. And if now you could say, well, Joe, I give me one herb. I need one herb here that everything you've talked about to this point for the vascular tone. Well, that herb would be Vascular Care. Now, it was used to be known as, they're always changing these names, which I know confuses all of us. It used to be called Horse Chestnut Complex. So there's 3 herbs in here. There's horse chestnut, there's butcher's broom, and again, ginkgo again. So horse chestnut seed extract is promotive of chronic venous insufficiency, poor blood flow in the veins of the legs, which may lead to leg pain, swelling, itchiness, and other symptoms, irritable bowel syndrome, male infertility, and other conditions. So remember, this is a circulatory herb specifically, from erectile dysfunction to poor circulation in the bowel to poor circulation in the legs. Butcher's broom is a short evergreen shrub of some family. I can't read it, but both the leaves and of the plant are believed to have diuretic and mild laxative properties. The plant extracts are widely used to treat varicose veins, hemorrhoids, and lymphedema. Now, this herb is specifically to prevent the breakdown in the lymphatic vessels and deterioration. So this is a very important herb. And the third herb in the Vascular Care, as I said, is ginkgo, which I already went through that with you. So we know what hemorrhoids are, and nearly 3 out of 4 adults will have hemorrhoids from time to time. Hemorrhoids have a number of causes, but often the cause is unknown. No, that's not true. We know what the cause is. I just gave it to you. It's too much sugar, lack of B vitamin, poor liver function. There it is. Poor portal circulation. So the causes are not unknown if you study standard process and Dr. Lee's life's work. And so fortunately, effective options are available. Yeah, topical creams, but they're not getting to the cause. And then, of course, I put this in so we all know what these are. And remember, people can have, they say, oh, I don't have hemorrhoids. They could have internal hemorrhoids. So, but they will say to you, oh, I am so uncomfortable down there, but I can't figure out what it is. It feels like it's more up in my rectum. Yeah, those are hemorrhoids. Those are blood vessels that have lost their integrity, and very difficult to bring that integrity back. So I'm not going, these go into the different herbs and things that they are saying that help with it. So you can look at this, these creams. And, you know, what is preparation H? It's just a vasoconstrictor. That's all it is, vasoconstrictor. But what the other thing that I really wanted to bring to you today about hemorrhoids is people using dry toilet paper. Now, this is a very lifestyle nitty-gritty, but the fact is, toilet paper really that is not moistened in some way, if you're going to use toilet paper, is really what keeps the irritation there. It's one of the external factors that really keeps the irritation there. So, and really what should be done is to either use moisture, wet the toilet paper and have some kind of lubricant on there, some kind of a lubricating cream of some kind that is soothing, or to get a duvet where you're washing that area, or to flush that area with water with the toilet paper. Now, most of us, you know, just use the toilet paper, but people with chronic issues should not be using dry toilet paper. Now, as far as food is concerned, you know, again, high fiber foods are what we should be thinking about. And they list them here. And the foods to avoid, of course, are dairy, you know, meats, too much meat, processed foods, as I said a little earlier. And by the way, rice, even though, you know, rice could be considered a fiber, but rice can really bind a person up. So that, in my opinion, should be added to the list. So again, here's the protocol from my book, Collinsonia root #1. Now make sure that you're using this dosage with a full glass of water, which is mentioned in my book. I just didn't put it in this slide. There's your Cyruta Plus again. There's your Antranex. There's your vascular care. In my opinion, with hemorrhoids or varicose veins, these are your 4 key products. That's why I devoted today to Collinsonia root and last month to Cyruta Plus, emphasizing the real causes, an inability for the vascular system to heal and be soothed, and poor portal circulation. So here are the other things to do for hemorrhoids that, and by the way, you're probably saying, why do you have chiropractic care? Craniosacral, because what is on the bottom is on the top. What is on the top is on the bottom. My brother-in-law has been a craniosacral practitioner for 40 years. And he's helped more people with hemorrhoids and varicose veins in his care of people. He's just retired at 76. But that was a big thing for him in his practice. They would go to him for that very reason, as well as chiropractic. So anything that's going to increase the circulation down there. By the way, cold laser therapy is very, very effective for that. So also other, like the Beamer, the Biomats, all of those are very good. This is an article from Alan Nittler, who was a medical doctor in California, who wrote about the Collinsonia root and his care. And of course, varicosities, again, what are the solutions from the medical science standpoint? Is stripping veins or cauterizing, or ablating them. And of course, you know, what is, I mean, it gets rid of the seemingly ugly look of the veins or the pain from them, but it ends the use of that vein. It ends the use. And so that blood flow needs to be rerouted somewhere. Nothing has been fixed, just the outer. So you can read through these and what they, what they recommend. But what I wanted to devote the last 10 minutes to here is this Collinsonia root. Now, as I say, Dr. Lee put this on the line in 1955. It's in the herbal world, it's known as stone root, and which is very hard, has to be broken up to grind into a powder. But as I go through this was a whole article that I don't think we put in today, but excuse me one second. Just had to cough. You will see as we go through this article, I just gave you the real critical or important points of this article, and briefly go through this tremendous article. It was written quite a while ago, I guess. When was this written? 1904. So this substance, stone root, which we know as Collinsonia root, comes in a capsule, is for bruises and wounds. That's what esoterically it's been used over centuries. And it's a tonic, a stimulant, and a diuretic. And it's I'm just going to scroll here. Yeah. Its action is a tonic upon the enfeebled muscular tissue. Well, wait a minute, Joe. I thought you said this is for veins. These are the other things that this herb has been used for. And from this action, the remedy has a distinct ability to overcome relaxed and atonic conditions of the heart muscles, the walls, the veins, and capillaries. One of the best remedies for chronic arterial diseases. So that is congestion of any kind. So of the mucous tissues, the pharynx, the nasopharynx, the larynx, anything to do with the throat and the mucous membranes in the body. Anytime there's congestion, irritation, and a sense of constriction. Now, we have limited this in standard process teaching to hemorrhoids and varicose veins, but I want to tell you what the eclectics were using this for. And chronic laryngitis, pharyngitis, bronchitis, again, mucous membranes. Catarrhal pharyngitis, now, the other, in this, they also go into gastritis, indigestion, pain and nervous symptoms occurring before meals, and liver and tendency to hemorrhoids. There it is. This is the first time they're mentioning it, this whole article. It's halfway through the article. They talk about hemorrhoids. But look at all of the other things. Early stages of diarrhea. So think of this product really outside of the box that we have taught you. Flatulence, biliary, infantile colic. And remember, this herb is so safe that it's one of the only herbs ever recommended before, during, and after pregnancy. So, and obviously it's in a powder. So if you give it to an infant for colic, you just have to wet your finger and put a little bit in the baby's mouth. So I've never used it, so I can't speak to that. 1888, remedy for antispasmodic properties, gastritis. Instead of they were using this herb instead of morphine or belladonna, because that was the only medicine they had to relieve these antispasmodic digestive conditions. To be used in the mouth, throat, lungs, kidneys, urethra, or rectum. Now, I have never used or thought of Collinsonia root for bladder infections, kidney infections. So, but there it is. That's what they were using it for. And there was something in this paragraph I wanted to say. Yes, Hale says it has a special action upon this circulation, hence its value in congestion of the liver and its circulatory apparatus. Not only is it of value in hemorrhoids, but it relieves spasms of the sphincter, ani prostatitis, prostatitis. So all those factors, I believe, in the anus area, and many of the vague pelvic and abdominal symptoms due to these conditions. So for that lower region, I mean, we talked about the heart and the throat, but you could see the broad scope that they were using this herb for. Alleviates many of the reflex disorders induced by them, such as cough, asthma, chorea, headache, and cardiac distress. So this gives you an entirely, as it gave to me, different view of this herb, much more expansive than we have thought of before. And the final one here is, oh, maybe there's a couple more. It works promptly if there is a passive congestion of blueness or dark discoloration of the membrane showing imperfect venous capillary congestion. Catarrhal gastritis, we already looked at that. And pain in the lower bowels, persistent, is also effective. In atonic states of the stomach, Collinsonia, satisfactory results. Collinsonia is also a tonic, stimulant, diuretic. So we already looked at all of these. Oh, this is what I wanted to read. For latter purpose, no remedy has exceeded Collinsonia in that form of laryngeal irritation and subacute inflammation known as minister's sore throat, chronic laryngitis, or what I put in my book as minister's voice. Now, you and I have seen these clients where they, over the years, they're always talking like this, the Godfather sound, and people with other throat and laryngitis and issues in that throat area, singers that say, oh, I lost my voice. This is the herb. This is it for them as well. It is the remedy for hoarseness in those who speak or sing for a livelihood, such soreness being due to either to vascular hyperanemia or to congestion. So, but our purpose, of course, is for varicose veins and hemorrhoids. And so I'm just at 12:30, and I hope you enjoyed this series. Next month, I'm going to do a series on anxiety and depression. I don't know if it'll be a two-part series. It just depends when I dig into it, how much. There's some recent studies that they're really tying in for bowel biome function and biome quality with depression, which we have known, but it'll be interesting to look at these studies. So that will be my theme, at least for January. Now, remember, with all of these changes in standard process, and pass the message on to others. I am not going to stop teaching. My other colleagues, Mark Anderson, Lo Keppel, Michael Gaeta, all of the ones that I know that have taught monthly, we're all going to keep teaching. So I'll be teaching the heart sound recorder twice a month, and the protocols in my book, breaking them down and going into the area of need from a nutritional standpoint in body health. And I will be with you as consistently as I have been these past 7 years, next year and the years to come. So thank you all for being on. Blessings to you, and have a wonderful holiday season and New Year.
Thank you, Joseph.
Thank you.
Merry Christmas.
Thanks.
Thank you, Joseph.
You're welcome.
Merry Christmas, Joseph.
Hey, Merry Christmas.
Thank you for everything.
You're
And we
welcome.
look forward to next year with you. Thank you.
Thank you, Joseph.
Thank you. God bless everybody.
Blessings to everyone too.
Happy New Year.
Very much.
Thank you, Lynn, also.
Yes, Lynn, thank you.
You're welcome. Thank you. Happy Christmas. Merry Christmas, everyone. Happy
Yeah,
Thanks for all
holidays.
your hard work, Lynn.
Yeah, Lynn will be with me next year too.
Yay!
The show must go on.
Yes, it should.
Yay. Yes,
Yay.
it should.